Good evening. The passage of time since the death of George Floyd has brought with it more names of more Black people losing their lives at the hands of armed police officers. We must continue the important work to stop this senseless loss of life. Our thoughts and prayers are with the families and loved ones who are in mourning, and we stand with and support all Americans who are protesting in communities across the country to express their frustration, disappointment, and disillusionment in a system that perpetuates structural racism. Many have said that we need to have a conversation about racism and inequality. So here we are this evening. We agree that it is always important to have deep and constructive conversations and discussions about race and racism, and then we must turn our talk into action. This is the time that we will be judged, not only by our words, but most importantly by the actions we take to be agents of change. These are the times that define the soul of a nation and bear testament to the humanity and moral values of a generation. Intentional and deliberate actions must be taken swiftly to end our nation's long legacy of racism. We need real solutions, and we need them now. Within the solutions we seek and implement, we need to ensure that we address and work to heal the trauma inflicted on every one of us through the violence we've witnessed, the violence we've lived through, the violence we've discussed, and the fear of more violence to come. This is the action and discussion we take tonight. I welcome you to this second session of our virtual series, Racism, Trauma, and What's Next. I'm Stacey Woodland. I'm the CEO of YWCA Tri-County area. And tonight we have a large and, might I add, illustrious panel. I will ask each panelist to please introduce yourself and your organization and describe the demographics of people you typically work with.
Hi, everyone. My name is Beth Herdman. I'm a licensed social worker and a practicing child advocate attorney. I got my master's in social work and my master's in law and social policy from Bryn Mawr and was a child advocate social worker for about 6 years at the Support Center for Child Advocates in Philadelphia. Then went on to law school and got my JD from University of Dayton in Ohio, and now work as a child advocate attorney at the Defenders Association of Philadelphia. The demographic I work with, I represent children from birth to age 21 that are in the dependency system in Philadelphia, which means they have either been abused or neglected. So that's me. I'm excited to participate.
Good evening, everybody. My name is Brandon Brown. First and foremost, I am West Philadelphia born and raised. I currently work at Temple University's School of Medicine Center for Urban Bioethics, and I also work as a certified trauma practitioner for Lakeside Global Institute. One of my jobs is to create 2 trauma-informed K-8 schools in North Philadelphia, in addition to trying to figure out how to insert the trauma-informed care conversation into first and second year teaching. Yes.
Hello, my name is Latanya White Springfield. I am the Director of Student Services at Pottstown School District. Our demographic is very urban. I guess that's what you want to call it here. Our entire population is considered free lunch. So a lot of our students fall below the poverty level. So that is the demographic in which we work with. And I also am a board member for the YWCA Tri-County area.
Good afternoon, everyone, or good evening. My name is Ty Dandy. I am an adjunct professor at Harkin College. I teach sociology courses for their partnership program, which are mainly for adults in the community in which they live, so partnering with nonprofit organizations. I am formerly a program analyst for the Department of Behavioral Health and Intellectual Disability Services for the City of Philadelphia, where there I oversaw organizations who provide supports to adults with intellectual disabilities or mental health diagnosis. And I am also a consultant, a private consultant. I'm an entrepreneur. And last but not least, I am a self-published author of a children's book. And our population, like I said, was adults with mental health diagnosis. And prior to that, I spent a lot of time working with at-risk youth through youth programming.
Good evening, everyone. My name is Karen Mcdougal. I am a professor at the School of Business at Penn State University's Brandywine campus in Media, Pennsylvania. I teach accounting and finance classes primarily to a large range of traditional students that cross many different races and socioeconomic classes. I also am a sole proprietor and a certified public accountant, and I have an accounting and tax practice. I am also a board member with the YWCA Tri-County and also the board treasurer and chair of the finance committee.
Good evening. I'm Vanessa Walker, a licensed clinical social worker. My primary job currently is I'm a middle school social worker in the Chichester School District here in Delaware County, Pennsylvania. I have a master's degree from Washington University and then a second master's degree from Bryn Mawr. I am coming with a background of working in child welfare beginning in the early 2000s in Chester, Pennsylvania. Then went on to work in drug and alcohol, working with pregnant mothers who were also using. And I also do private practice, seeing individuals and families. And so my primary demographic is working with students from the ages, I want to say about 8 to 18, and kind of a mixture of urban and suburban here in Delaware County.
Oheniwa.
Oh, yes. Hi, my name is Oheniwa White, and I am a full-time faculty member at Alvernia University. I teach social work, and I'm the BSW program director. And the population that we teach at Alvernia in our evening program is adult learners, primarily Black and brown women, and on main campus, traditional students, 18 to 21-year-olds. I'm also a mastered social worker, and my practice life has been around child welfare, and I'm a PhD candidate, and my research is public health social work. I'm looking at adolescent motherhood, postpartum depression, and social support.
Thank you so much. And then we have also had join us Congresswoman Madeline Dean. Congresswoman, if you would take a minute to introduce yourself, and if you could please maybe talk a little bit about what thoughtful legislation is coming up that will address some of the trauma that we've experienced from both COVID-19 and the death of George Floyd and the rest of the racial unrest in the country. Thank you for joining us.
Thank you for including me, Stacy. I was pleased to be with you and Diane yesterday at the YWCA Pottstown. And thank you for your leadership. Thanks for including me. If I could, I would change this name. That's not my name. Megan Janis.
You're gonna have to do it yourself. I'll tell you how to do it offline. We'll get you some information.
Thank you. Thank you. I should go bug my adult sons. But in any event, I'm Madeline Dean. I'm the Congresswoman for the 4th Congressional District, which is most of Montgomery County and a piece of Berks County. I was so pleased to be included briefly for this six-part series that you're doing on social justice, on racial inequities, on systemic racism, and how it infiltrates every part of our lives, our history, our communities, and what happens. I feel so lucky, Stacey, you and I talked about this, but I feel so lucky to be in Congress at this incredible civil rights moment. It's an extraordinary challenge between the COVID pandemic, the economic collapse, and the civil rights moment, and an administration that has been so difficult to work with, because all I care about is really what your mission is, which is raising people, raising our communities, and seeking greater equality and opportunity. So briefly, I'll tell you a couple of bills. You know that we passed on the economic side and health side, COVID legislation. So we have passed a total of 5 bills, and I'm very proud to say they were very bipartisan. They were nonpartisan. There was an admission by this Congress in an incredibly polarized time that we are in a crisis like no other. And so from March the 4th, when we passed our first bill of $8.3 billion to get money toward testing and health and hospitals and first responders, through the CARES Act, which was more than $2 trillion worth of relief for individuals, for families, unemployment comp, nonprofits, direct cash relief to individuals. We passed robust legislation nearly unanimously. I'm proud of that. Unfortunately, we had another bill, the HEROES Act, which we know desperately in my Democratic caucus, the majority of the House, we know we have to get more relief out to families and communities, to school districts, to municipalities, to nonprofits worthy like yours, to school programs, to education. Unfortunately, that bill passed the House almost 2 months ago and languishes in the Senate. I am hopeful we will come back and do that. In there is nearly $1 trillion, $900 billion for state and local governments, which will be very important to all of our communities. $100 billion toward education equity. Before I came to Congress just this term, I was 6.5 years a state representative. And so I know the challenge of education funding in this state, that we don't do it adequately and we don't do it equitably. And in my caucus, we have been fighting for that. So we'll continue to fight that. So lots of robust dollars, but not perfect. There are gaps in the resources that we have sent. Certainly, all three of the crises that we are under right now exposes the systemic inequities, whether it's people of color, whether it is people who are poor, what I call poorism. It's racism, it is poorism, and it is also the fact that we have a public health system that is inequitable. Maternal health, I think about maternal mortality and maternal health and the inequities in that. In this most developed of countries, why is it that women of color are much more likely to die in childbirth at or near as a result of a pregnancy, or have very adverse health consequences than Caucasian women? So there's lots more we need to do in that. On the criminal justice reform, policing reform, you know that we passed, and I'm a member of the Judiciary Committee, so I'm very happy to have been a part of the conversation around this, the George Floyd Justice and Policing, a huge sweeping bill that passed our House in record speed. This is a package of bills that I'm pretty sure you're all aware have been introduced session after session after session individually. George Floyd changed the world, as his little daughter said. My daddy changed the world. Karen Bass, the chair of the Congressional Black Caucus, put together a package of bills that is remarkably important and powerful. It is not the be all and end all, but just some of the things it does. It would make lynching a federal crime. Can you imagine that it is 2020 and we have failed to get that done? It's stunning, but that is in the bill that passed our House and now is awaiting consideration, I hope, in the Senate. It would require data collection on bad cops so that there'd be a national registry. So that, for example, I'll give the anecdote of the case of Tamar Rice, the 12-year-old who was shot in a park by a police officer who was disqualified to be a police officer in another municipality, but he moved municipalities, nobody knew it. He didn't report it, of course, and shot and killed that beautiful baby boy. It would require body cams and vehicle cams. No excuses for that. It would end qualified immunity, which effectively in our civil justice system keeps police officers free from responsibility from violating any one of our civil rights. It would end that, and it's well past the time. It would establish new standards for policing. So it's a powerful bill. We passed it. But as you and I spoke yesterday, Stacey, I really am committed to getting that done. But I know that's only one piece of the puzzle of 400 years of racism in this country. And the other things that we must do are education, jobs, housing, equal opportunities for educational advancement, for careers, mental health, addiction, and so much more. So even though it's a challenging, horrible time, I have some optimism that we're actually, Sherilyn Eiffel was before us when we were considering the bill, the George Floyd policing, justice and policing bill. And she said, we are in a civil rights moment and we cannot let it pass us by. So I'm committed, and I love the diversity of people like me, white people, are owning this as well. We have to own it. We have to listen, we have to learn, and we have to make changes.
Thank you so much. I think that justice and policing bill, thank you for talking about that a little bit, because I do think that it helps us really segue into diversity and awareness as part of this discussion, and how we start to think about what's important from an employer standpoint and from a constituent service standpoint. What are important pieces, and how can we support the mental health of attorneys and educators and legislators as we navigate through all of these traumatic events? I think I would direct that question first to Brandon Brown, if that's okay. You're muted, Brandon.
So if I could, I want to look at trauma in a different way, right? So if we were to just take the notion of trauma and say, you know what, it's a personal experience with neurological consequences. All right, and what do I mean? Because I think oftentimes what happens is we overuse the word trauma, okay? And we really haven't pinpointed what trauma is. Trauma is just a very subjective experience. So something that could be very minor to me could be very huge to you. And I think the other thing that we have to add to this is that it has neurological consequences. We're not going to get into a conversation about the brain, but somehow there are these associations, interpretations, and generalizations that are made with each act to say, am I safe in this place? Do I feel loved? Do I feel heard? Do I feel valued? So I think if we kind of broaden the definition of trauma, because in truth, there are about 30 different types of trauma. And I feel that if we started there, that kind of helps people understand that trauma is not just kind of what is portrayed on the television screen, but trauma is just day-to-day life. Trauma is living in a food desert. Trauma is living in noise pollution. So there's all different types, and I would leave that as my opening statement.
So can I push you just a little bit to ask? Sure. So I hear you about the everyday, the daily trauma, but when you layer that with all the trauma of experiencing a pandemic, and then the death of George Floyd and the protests and the subsequent police brutality that we've been a witness to, how might we begin to think differently about what it means to prepare ourselves to support staff members or children or adult students? Like, how might we prepare ourselves to see what's happening and be able to address it? Is there?
I'm going to say two words.
Please.
Self-care. Okay. Because here's the thing: I can't take care of you if I'm taking care of myself, right? So I could give you the analogy if we were all on a plane, and we've all heard it, in the event that there's a drop in air pressure and the bag drops in front of your face. If you are with a child, what do they tell you to do first? Put it on yourself first. So the whole notion is that if we want to take care of other people, we have to make sure that we're taking care of ourselves. We have to make sure that we are sort of assessing or reflecting how we feel going through this. Because whether it was the murder of Mr. Floyd, whether it's COVID, everybody in some way, shape, or form, like their sense of safety, their senses of predictability, and all of that has been shattered. Okay. And in a very broad sense, that's what trauma is. Trauma is a loss of safety. It's like, I don't know what tomorrow brings, but I'm going to try to get as much power as I can. So the first thing that I would tell anybody is that if you want to help others, you really have to walk through this and process this yourself so that you are in a better space. And what I always try to tell people as I close my statement here, self-care isn't selfish.
Thank you so much. Does anybody have anything to add?
I will. Thank you for that, Brandon. So I just want to add two things. So when you talk about, we overuse the word trauma, I think it's undervalued as well, right? So I think about when you grow up in the inner city and you come out your door and so-and-so has been murdered or they've been shot, right? You don't have a mom or a father. It's something that you become accustomed to and not really realizing that that is a traumatic experience, right? You live day to day in that environment. And we don't really deal with that, right? We just say this is just another social factor that impacts so-and-so's ability to do X, Y, and Z, to obtain a job, to pass school. And then on the self-care piece, I myself am in that stage, right? And so in the wake of COVID, in the wake of George Floyd, and just my own professional development, that is why I took the leap and left my job and I moved away, right? I'm now a resident of Dallas because I needed that space for myself so that I can heal and figure out what my next steps are going to be. And in order for me to take whatever my next journey and my professional endeavors, I needed to step aside from the environment in which I was living in and working in for so long. You know, I grew up in North Philadelphia. I went to Bryn Mawr, right? I worked with populations in the city, mental health, at-risk youth, lived in that environment day to day, and working in that can often be traumatic in itself and sometimes toxic. And while it's great to be in an environment where you're on the ground running, it also can be hindering for your own self-care. So I agree with you, self-care is first. So I just wanted to add that because that hit right into what I'm experiencing right now.
Can I add something real quick? We might have people that have been growing up in places and spaces that their definition of safety is toxic.
Yes.
Right. So
Yes.
they have never experienced what it means to be calm. Right. So I think oftentimes it's really about definitions and it's just understanding people's history.
Right. Absolutely. Create an definition.
So thank you. I would like to use that, what Brandon and Ty have just shared, and maybe go to Beth and ask, when we're thinking about children, Beth, I would love to know from your perspective, how might we be better prepared? I heard Brandon, I heard him loud and clear that we need to take care of ourselves, that we need to put our oxygen masks on first. But if we have children in our care, once I have my mask on, how should I be helping them manage through the trauma that they are experiencing, either in their daily lives, as Brandon referred to, but also from these most recent racist acts and the unrest that our country is in?
So, I mean, I agree with both Brandon and Ty on everything they were saying, and dealing with vicarious trauma as a professional as well, dealing with these issues. I think in dealing with kids, we need to look at it in that day-to-day realm, look at their behaviors and how trauma may be triggering it. So they may be acting out, they may be yelling or running away. We're seeing that a lot with our teens, running away, especially with the COVID, when they feel stuck, when they feel bored, and recognizing that there's underlying trauma that is triggering that. And instead of, lashing out or them kind of getting in trouble, trying to take a step back and saying, why are these behaviors happening? Because a lot of, especially the clientele I'm working with, already have so much trauma. They come with so much baggage, so much trauma. And then with COVID, it just layered on top of it. A lot of these kids that we're seeing, especially in the Philadelphia area, all visits have had to be virtual. So they're not seeing their family. They're not seeing their siblings. That just adds more things. They're not seeing their friends at school. And to be able to sit down and have those conversations, I think, is the most important. And to just listen to these kids, because at any age, and obviously I would, say to do it at whatever developmental stage these kids are at, to meet them where they're at. You hear that a lot in social work. Meet this person or this child where they're at, but to listen and say, how are you feeling about that? Those are the conversations we're having with our clients. How are you feeling right now? I hear it in your voice. You sound bored, but what else is going on? So I think the biggest thing as parents, as professionals, just talking to kids about it and letting them talk, not kind of talking at them. I think that's the biggest thing, because kids, they're smarter than we give them credit for. They know what's going on. And what we're seeing a lot is the youth are the voice going through this. So with police brutality, I think that's a conversation we need to have with these kids. How are you feeling? Because a lot of what Ty said, in going outside, they're seeing their friends get shot. They're seeing, you know, they're the ones dealing with police every day. So I think just taking a step back, listening and asking these questions and giving some kids some credit, but also recognizing behaviors may be part of these traumas is something to do.
Thank you so much. At the YW, I would be remiss if I didn't go to Ohiniwa and ask you if you could talk a little bit about the impact of trauma on women. I think what I've read and what I've learned and what I know as a woman, a mother, a grandmother myself, is that you bear the trauma of everybody in your family and still have to manage. And so can you talk a little bit about what you're witnessing?
Absolutely. And I think Brandon said something really important, because when we think about health and we think about place and how place matters in health, you know, and so people experience, he talked about trauma and complex trauma. And for women, it is a complex trauma because we are trying to help process everybody else's experience of their traumas. And so we often don't have the luxury to self-care because we're trying to help other people process their trauma. And in my space where I work in higher education, it shows up a lot in terms of how people aren't able to attend to their own education, attend to their own needs, because they're often just trying to manage everybody else's needs to make sure that everybody else is okay. And a part of that is just societal in terms of women and how we are identified as the nurturers. And that's not a bad thing, except we can't put the oxygen on first because there are too many people that are demanding our time. And so that we're almost saving people at the expense of ourselves. And I don't think that we've learned how to work through and we don't know how to own self-care without feeling selfish. And I heard somebody say recently that the notion of trauma and racism gets under our skin, and what that looks like in terms of our overall health and well-being, because if it's under our skin, it's a very part of us. You know, so for women, it shows up as that complex trauma that we're not safe anywhere with anybody because we don't have time to attend to our own needs.
Thank you so much. And I think before we move on from kind of the diversity and awareness section, I would just ask, I know we have some professors on the panel, and I know we have Dr. White from the school district. As we are thinking about re-entering classroom spaces with young people all around, are there concerns that you have, and are there things that you wished families and young people knew ahead of time, or coping mechanisms that you wish we could talk about tonight? Dr. Mcdougal, I'll go to you first, and then Dr. White. You're muted. Yep.
My apologies. Well, first of all, I want to thank Ohiniwa. I loved what you expressed there, and Brandon. We would love to be able to embrace a lot of these concepts like self-care, which I've always struggled with being a mother and a daughter, with my mother living with me and raising two children and my husband. But just as Ohiniwa said, you know, it's a concept that we will strive for. These phrases that have come across throughout time, like working the room, like lean in, it takes time, and the same sentiment applies to all that we're dealing with right now. I know at Penn State on our campus, I think the major task that has been most effective, especially with this population of college students, and they're a very intelligent group here. I have been amazed at what they have been doing in terms of organizing and speaking their thoughts throughout all of the peaceful protesting that's been taking place. And actually, I think it was probably about 2 years ago. So maybe, I don't want to say we were ahead of the trend, but we formed 2 student groups. One was called the Society of Students of Color, and then a second was the White Accountability Group, and allowed the students to self-select to join the organizations, and dealt with issues like the racial inequalities, systemic racism, engaged in exercises. And a lot of it, I think what the key is going to be to get us through this is communicating. Because as Representative Dean said, we really need to talk to one another. We need to share our experiences. We need to embrace each other's ideas and realize that we don't know what the other party is going through. And I think that is what's going to be necessary for us to get to the next stage. But I personally feel very positive at the strides we've made just this year since the death of George Floyd. And I'm hopeful that we're going to continue to implement strategies and activities to keep the lines of communication open and to just advance this issue more. In terms of returning to school, and I hope you're not referring to that specifically, Stacey.
I was not.
Okay, good. So.
Okay, thank you so much.
So I think that when we're looking at a blend of COVID and Mr. Floyd and a lot of things that have been going on, I think that, Stacey, you've been there when we're going to these protests. I've seen a lot of our students there. A lot of our students really having some difficulties. I've been able to enact my counseling staff to really work closely with the students because it is a lot for them to take in. As we sit as administrators of the district, and we've developed task force that also has some parents and other levels of our school community on that task force, I think the first thing is always going to be safety and understanding that it's not just safety of our students, it's safety of our staff as well.
That's right.
I understand our staff have gone through a lot of these different things and have been involved in a lot of these different things. And they have that same fear and uneasiness about moving forward and what it looks like for school. And it's funny you threw that question my way, because in our last task force meeting, our guidance counselor is one of the people on the task force, and she really put out, like, how do we prepare before school starts, knowing that we're going to have students and staff coming in here with heightened awareness of COVID and of racial inequalities and different things of that nature. And one thing that I need all hands on deck. I need all counselors that I can get on deck, mentors on deck. And it was funny because we had a student also part of that group, and he said, well, you know what I'm really thinking is for senior projects, we really have some of the high school seniors go down and start mentoring and working virtually with elementary and middle school students, and really trying to show them that no, everything is not going to be okay, but we're going to work together to get through this. And sometimes that's easier to take in as a child from another child. And really start equipping not just our staff, but our students with some of these tools that they are going to need to be able to tap into, which is not an easy task. Because the other part of our world is, how do you get kids in school? How do you make sure you're disinfecting after each use? Can I do 6 feet between desks? And really starting to look at what is the state requiring us to do versus how do we know our population of families. So how do we do that and make sure that they can get childcare for work if we're saying maybe one day you're in school and one day you're not? So there's so many different things that get put into the pot. Now, granted, we do have an evolving plan that we shared with staff today. And I think that plan is going to continue to evolve as the governor continues to make adjustments, as our students and the staff and the families through our surveys start giving us additional information, utilizing virtual services, but really making sure on that back end, seeing as though we are a community school, that we're moving through everything.
Thank you so much. And I know that we only have Congresswoman Dean with us for a few minutes, so I just wanted to go to our chat because there were a few questions that I believe only she can answer. And one is there any action citizens can take to move the George Floyd Justice and Policing Act forward quickly? Calls, letters, etc.
I thank you for that question. And as I said, it passed the House, swiftly passed the House. We had a majority, if not all Democrats, vote in favor of it. And we did have bipartisan support. I think there were 3 Republicans who voted in favor of it. So it has left the House. It sits over in the Senate. What can you do? You can do exactly what you're doing now. Advocate for it. Contact our senators. I know that Senator Casey is on board. I don't know that Senator Toomey is. So it matters that public sentiment push this reform bill forward. As Speaker Pelosi likes to quote Abraham Lincoln a lot, with public sentiment, almost anything is possible. Without it, almost nothing. We need public sentiment to push it forward. But I want to compare that to an awful lot of other bills. We've passed in this Congress, we've passed something like 285, 300 bills in a bipartisan way that sit dead over in the Senate. A couple that I care deeply about. We passed this back February a year ago. We were in Congress only since January. By February, we had passed out of Judiciary and out of the House 2 bills dealing with something I care about, which is gun violence. Background checks, universal background checks passed one day in late February. The very next day, we passed the bill that would close the Charleston loophole. The Senate has done nothing with those bills. We could be saving lives with those bills. So I say that just as a plea and a cry, be squeaky, tell our senators, of course, say thank you to the ones who support us, but much more importantly, urgently, public sentiment as it begins to turn on these politicians at the end of the day. Maybe they'll do the right thing in the absence of doing the right thing right now. That's the same that is true of the Justice and Policing Act. I do have hope and optimism that I believe a new administration and a new Congress, a new Senate will get this done. If we fail to get it done this calendar year, I have confidence we will do it the next time. I have optimism and confidence we will do that bill and many others that will bring us to a more equitable place. The other thing I care an awful lot about are the schools and reopening them. I'm a mom, I'm a grandma, I'm a former teacher. We have to give schools resources, flexibility, and the truth about the data. That's the only way to do it. And let them run. I've been on multiple calls with educators of all levels. That's what they need. They need the truth. They need dollars and resources. And that's what we owe them. The government owes that, frankly. So when the president threatens to, as I call it, defund our schools, we have to call this administration out on that. We don't need to defund our schools. We need to fund them more and more and more to get through this pandemic and give the flexibility that educators need to safely educate our kids. And I wanted to end, if I could, with one little anecdote.
1 more minute. Go ahead.
1 minute, real quick. I've had the pleasure of serving with some really historic figures. One of them is the late Elijah Cummings. And when I was a brand new Congresswoman, when you could, we can no longer sit on the floor and talk to one another. We have to just keep passing through to cast our votes. But I sat down next to him one day and he said, "Who are you?" I told him who I was and where I represented. And he said to me kind of wistfully, and this was July of last year, just slightly before his death. He said to me sort of wistfully, he said, "Madeline Dean, 300 years from now, your ancestors will remember you were here." And I looked at him really puzzled because I'm talking to Elijah Cummings, for crying out loud. They're going to remember he was there. There's no doubt about it, the power that he is and the moral force that he is. But it occurs to me over the course of these traumas, whether it was impeachment or now the coronavirus, our civil rights moment, our economic collapse, they're going to remember this Congress was here. They're not going to remember I was here, but they're going to remember what we do or what we fail to do. But I also say that it's about you also. Our children are going to remember what we did in this moment, what you leaders are doing in this moment. And that's what gives me optimism for our future. We'll get it done. It may take a longer time, but we have to keep our eye on the prize. And I'm honored to be here with you.
Thank you so much for joining us this evening. I know that you have other engagements and this wasn't even on your agenda until this,
No,
so I appreciate your flexibility and you joining us. Thank
I'm
you.
so glad it worked out. And thank you.
Thank
Hello
you.
and good evening to all of you.
Thank you.
I want to move on to the next segment of our discussion. And I really want to talk a little bit about, and Vanessa, I'm going to be coming to you first. Generational trauma has impacted the relationships between police and communities of color forever, perpetuating damaging stereotypes. When you are faced with stories of children and family members fearing the presence of police in their schools, how do you respond?
Oh, that's a good one, because we do have a police officer in our school. I work in the middle school, 5th through 8th grade. And one, I acknowledge and I validate that they do have a legitimate concern. It is not irrational to have a concern about having a police officer in your school, in your classroom, possibly stopping you in the hall. It is a legitimate concern. So one, I do validate that. And we kind of talk about it. We process that. Like, where is it coming from? You know, what can I do? I mean, and I acknowledge some kids are like, I don't want to talk to the officer, Miss Vanessa, if I don't have to. And I acknowledge that. If there's nothing that is a safety concern, okay. But for those that are in a space of, you know, they have a curiosity to want to know about, is there good cops? You know, then we have that discussion. But as Beth said, I meet the students where they're at. And I do have to acknowledge, especially what's going on with George Floyd, that they have a legitimate concern and a valid fear to be fearful to some degree of police. And the role of policing in schools and communities is very complex, right? Like, you know, they're there to do drug and alcohol education, but also if that kid is in emotional crisis, they can go out in handcuffs. So it's a very strenuous relationship. So I try to, if I can, be a buffer, be a safe space that they can process those feelings. And if they're willing to engage, like, you know, they want to talk to the officer, they want me to do that with them, then I accompany them. But first and foremost, we validate, because their fears are very legitimate. And some of them have some very tragic stories about, you know, police breaking in the middle of the night, doing a drug bust or a body warrant, things of that nature. So, you know, I start to validate and to make a safe space for them when they come into my office.
Thank you so much. I didn't know if Dr. White or Beth, if either of you wanted to add to that question.
Yeah, I can add to that. I think that it is very big and it's there. We also have a resource officer who goes throughout K-12, mostly at the high school and middle school area. And I think that one thing that we're really trying to do is just call it out there. And really last year, what we did was really try to figure out a way of having the police come in different aspects, not only when it's time for it to be an issue. So the police are coming in and reading to students, or they're having pizza or walk to school with a cop and doing some things like that, because it is a real fear. And we do see that students immediately shut down. Oftentimes people think that if we have the cop come in, the kid is going to be like, okay, I'm just going to sit here and be quiet now because you're the cop. And that's not what happens. If anything, it exacerbates the situation. And now they're not doing any de-escalation tools that they should be working with them for. We do know that our current resource officer, we actually provide them with training and working with students with autism and students with special needs and different things like that, so that he can start recognizing this is him in crisis. It's not a police officer that he needs right now. It could be a social worker or a school counselor or a psych that is coming in, or behavioral specialist to support him. But I think that it's an education on cops, not just educating kids, it's educating police as well. This is the type of population you're working with. Everybody isn't going to respond the same way because you have a badge. And I think that is for me, the biggest thing is like, well, just like principals, the principal can go in a room and think they're going to shut something down. It's not going to happen just because you're a principal. You got to build relationships. And for me, that's where it all starts.
Thank you so much, Beth.
Yeah, I just wanted to, I'll try and be.
Oh, go Beth, I'll go after you. Go.
I'll just try and be short, because I echo exactly what Dr. White and Vanessa were saying about this. A lot of our kids, the only experience they've had with police has been a negative one. whether it's watching a parent get arrested or having the police actually separate them from their family. And one of the things Vanessa had said, like, these kids with these traumas are being labeled as a bad kid or being sent to, a different school because they're bad or they're acting out, when it's really they're exhibiting these trauma responses a lot of times. And I think we need to be more cognizant that that is what they're doing. They're not bad kids. And I think trying to kind of get to the root of that and to acknowledge that is like one of the big issues that I see right now, especially with the fear with the police. I mean, I think that a lot of our kids just automatically, as Dr. White said, just have this image, and having those experiences like walk with a police officer or having those positive kind of connotations, I think is extremely important, because, especially at childhood, these are the notions that you grow up with. And it's hard to change that when those have been your only experiences.
Thank you so much. Brandon, you were going to comment.
Yeah, so I wanted to look at transgenerational trauma like this. What if it's possible that I'm living the traumatic experiences of my grandparents? What if it's very feasible that people in impoverished communities or people of color are learning how to fear the cops before they know their ABCs? And that this is a historical thing, right? So I don't want to necessarily waste so much on the problem as it's really about talking about the solution, right? And I don't care who you read, whether you read Ben Perry, whether you read Casalino, whether you read anybody else that are in the trauma field, it's usually around a couple words. It's one, honoring my vulnerability. If I'm having a problem, I need to understand why I'm having that problem, all right? But then the other thing is that there's got to be some sense of hope. And I think oftentimes when we talk about trauma, we think that people are walking around with scarlet T's on their chest. Like, I've been traumatized and I'm going to be traumatized forever. Instead of just simply understanding that there's hope. And that's why I am so honored to be on this event tonight, because all of you I see tonight, you're pouring hope into people. And if you've ever followed Les Brown had a statement. I don't know if it was necessarily his, but he said, sometimes you have to pour hope into people until it kicks in for themselves, right? So we can spend a lot of time talking about the problems. And I think that's the easiest part. I think the hardest part comes in and says, you know what, let's talk about this vulnerability. Let's talk about how we really feel. And let's talk about how we feel that this could end. And this could be with adults, this could be with kids, because oftentimes kids are just living what they see, not necessarily what they've experienced. So if my mom, my dad, my grandmother are doing these things, then I have to do it because that's what they're doing. But I might not have a reason behind doing it. I'm gonna stop.
So, I thank you that the transgenerational trauma that you talked about, I think I would love for Ty and Ohiniwa to kind of weigh in about that, because I think that the impact on women is profound for what you just brought up. And I didn't know if you wanted to weigh in a little bit, Ohiniwa.
Yes, I will. Brandon, you said a mouthful, particularly for women, because when we think about it biologically, we carry all the eggs that we're ever going to have in our life. So we're carrying children. So when you talk about that transgenerational trauma, we are experiencing trauma that has been experienced directly by people who carried us. And how that shows up is back to racism and those things being under our skin and impacting our health, impacting our mental health, our physical health, our emotional health. I just think that we can't overlook that. We can't overlook the fact that some of these things are passed down, and we've learned how to adapt. And it looks like, as Beth said, those trauma responses, and people don't understand why a 5-year-old may have a response to something that they didn't experience directly, but that exposure and the modeling that we experience. Somebody said something once about just health related issues, and how people, families may have generational diabetes or high blood pressure. And it's not that those things are passed down, but it's how we live that's passed down. And so we think about that in relationship to how we respond to these traumatic experiences. And so if we're parenting in fear, then children are going to respond to the way we parent them. If we're educating in fear, whatever we're doing, if we're doing it out of that space, our response is a fear response, then people are going to respond and they're going to take up those patterns that are fear response patterns. So I think it's important that we understand how our behavior is shaped by the traumatic experiences, and then how those behaviors become a model of practice for children and communities that we're exposed to.
And I'll add the opposite of that. Thank you, Oheniwa, for that. And Brandon, I just want to, from a solutions-based perspective, just add, it's important when we're breaking the cycle that we use that same model and behavior, right? And I speak directly from that, from a professional and from a person just as a Black woman, right? A Black lesbian woman, right? Living in the now, and who come from poverty and is working my way out of breaking that cycle, but also helping my family. So having that dialogue, right? Having those real conversations about trauma, really talking about recently and having a conversation with my mom. One of the things I asked her was about, what was something in your life you wanted to do that you've never been able to accomplish, right? And that was a hard conversation for me to have, because you don't really see your mom as an adult. You see your mom as a mom, or you don't see them as a human being until you become an adult, right? So you just look at them as the doer. And so even in the healing process, it's part of having those uncomfortable conversations so that you can see the person as an individual. So then you have those aha moments like, oh, wow. Like, for instance, something as small as, we think about in Black communities, we talk about, right, it's this insider. When people get their income taxes, they buy new furniture, right? Or they might get a new washing machine or something as small as that. And then having a conversation, I was talking to a family, and one of the parents, she discussed the reason why she buy new furniture every year is because when she was growing up, they only had hand-me-down furniture, right, as a child. And so it was important to her. She didn't want to live that. And so while her kids didn't understand why she was wasting money on furniture, to her, it was a huge deal. But even something as small as that dialogue, right, that conversation, to understand some of those habits or that behaviors, if you will. So that's one of it. But the big part is that communication piece, having that dialogue, being able to talk about where we come from to where we're going. And so that it's something that's not remiss, right? It's not just that those things happen, those behaviors, those traumas, they exist, and therefore we continue to live. It's no, they exist. How do we break that down? I think I just talked about like diabetes, right? Like that medical perspective or that those health issues, if you will. And we talk about breast cancer, right? A lot of Black women don't go get tested until they're 40, right? And having to fight through the medical system to even just get a genetic testing done to find out if you have the BRCA1 gene, and how is systemic racism in that, right? You can't get the testing done if someone in your family hasn't had the test. But if someone in your family didn't have the test, then you have to wait, right? So your chances of breast cancer increase. So having the dialogue and the education to be able to have the conversation in the first place. Just want to add that piece.
Thank you so much.
Can I add something to that? I'm sorry.
Oh, please.
So in addition to that, I think it's important to also consider that it's not that people don't just get the test. Sometimes they don't have the resources to get the test, right? So that when we're thinking about those systems of oppression, where people may not have access to health insurance that will cover tests. And I'm going to give you a personal example. I get a mammogram every year. And about 4 years ago, I had to pay an additional $300 and something for a type of test that I needed because of density. And I had to fight with the insurance company because they were not going to cover that particular test. That was a necessary test. It wasn't a selective or optional test, or it was a test that I needed because based on my biological structure, I needed these 3 parts of this test. And so the claim said, you need this, but we're not going to pay for it. Thankfully, I had flexible spending. For people who don't have flexible spending, they're either going to decide to incur the cost of that test, have a bill for that test. That bill will later affect their children being able to get financial aid if it becomes a credit issue. So there's this cyclical, when we're responding, it's not just that people aren't acting, it's that sometimes there's not access or there's limited resources. And I think that's important to understand, is that it's not that people are being negligent, but there's race, like the trauma is health, like there's health inequities that contribute to people being unable to access those sources, those resources.
Yeah.
Absolutely. Thank you for adding that piece.
Yes, thank you so much. I think if we go all the way back to the beginning of our discussion, when Brandon talked about all the different kinds of trauma, like he brought us full circle before any one of us ever said one word. And so I thank you for your wisdom there. I think that it's important though for us to kind of flesh out as much of it as we can so that we can support the rest of the communities that we serve to be better, to get better, to have better, right? So thank you so much. I would like to really talk about the fact that knowing that seeking professional therapeutic supports are often shunned in communities of color. And so how do we help people put their oxygen masks on, to go back to Brandon's earliest metaphor? How do we help them with self-care? How do we encourage them to seek the help that we need and the help that we seek? That I would let anybody answer first.
All right, can I speak to that?
Please.
So I would say, and it goes back to Brandon talking about our vulnerabilities, right? And some of that, particularly for women and mothers, is being able to identify our vulnerabilities, not having to operate in that strong woman kind of persona, and getting help, right? And help is therapy or whatever that looks like, but that's important because we become the models for our children. So if our children don't see us seeking help for ourselves, like if my daughters see me knowing that I have a weekly or a monthly therapeutic appointment, and I make that a priority to say, listen, I have an appointment with my therapist and I'm going, and I'm probably going to process some of these things. As our children start to struggle, we've done a radical thing by giving them permission to ask and seek help. And I think that's important. And I think for so long, we've been hiding that we aren't strong, and that there's something wrong with us not being able to weight the world on our shoulders. And at the same time, wearing the world on our shoulders and is killing us health-wise. So being able to model that radical act of self-love, of just seeking help for yourself. And I think it's important because it becomes the message to our children that it's okay to get help, and this is what it looks like, and this is how you do it.
I think Brandon said honoring our vulnerability, right? Anybody else weighing in for this question?
So that's
wow, Brandon.
That's a PhD question, right? So let me, and I see Ohanawa laughing at me. So I think really what happens is that in a lot of places and spaces, people just really have a dysfunctional definition of what it means to be strong, right? So being strong means you don't ask for help. Like you will struggle to the bone. You will eat all of these microaggressions and literally make yourself sick, right? So, I mean, just the whole notion of like a person talking about when they're hurting. And I'm just talking about it in the physical sense, right? So I know time is short, but I just think that I think the bigger problem is that many communities have been taught sort of this unhealthy, perhaps almost this toxic definition of either what masculinity is, what femininity is, what strength is. And the only thing is you don't know that it's not healthy or till it's not toxic until you see the opposite.
Well, especially in Black communities, right? That
Yeah, but what I'm saying is,
feminine,
I was never challenged about my definitions of masculinity until I saw other definitions, right? So oftentimes, like in certain instances, like it often starts with one question: why do I believe that? What made me think of that as a belief? What made me accept that as a personal fact? And oftentimes, I would argue, if you really press it, people will be like, I don't know. I guess it's what I saw or what somebody told me, but I've never experienced it myself.
Beth?
In working with a lot, especially with teens, and trying to kind of get them to engage in some sort of therapy, I think what we try and do, at least in the dependency system, is try and use it as this is your voice. I feel like a lot of kids in the dependency system feel like they're voiceless, that what they want and what they think doesn't matter because the judge isn't going to listen to them, that sort of thing. But using kind of that this person is someone you can actually have some sort of control out of how you feel, that you can tell this person, and to try and, you know, use that as a way of encouraging getting help and you know, seeking the opportunity to get therapy or to even just talk about what they're experiencing, because I know that's a really, really hard thing, especially a lot of the youth that I see who have the experience of, oh, I've seen a therapist and it didn't help. I've done this, it hasn't helped. And to kind of break that cycle that, you know, as we know as professionals, the first therapist may not be the therapist that works for you. And to kind of have that conversation, just because this person didn't work doesn't mean someone else doesn't work, or let's try a different thing. So I think to have those conversations and to try and put it as they're making that decision, that this is your chance to use that voice, I think could be helpful as well, especially for youth.
If I can, I'm sorry, go ahead.
No, please, Vanessa.
I just wanted to add to what, like, I do private practice and I also work in a school. What I see is a lot of times is primarily Black and brown clients and a predominantly white therapist. And there's a disconnect in understanding communication. You know, they're like, oh, she's talking really aggressive. No, she's just talking and she's loud, and that's okay. And so I struggle with that disconnect and professionals not getting the education or additional training to understand their client population. So you can get the kid there, but then they're turned off based on the experience. And it's hard to get them back after they've had that negative experience. Because children can't, if they need to see some representation of something similar to what they know. Like when I come into a surprise, they're like, oh my God, you're brown. Yeah, there are Black therapists, there are Latino therapists, but they're not as prominent. And I think it hurts when we're trying to get the community to seek therapy. And when they do, it's like, they can't, there's no, they can't bridge that gap to feel safe, to be vulnerable, to actually talk about what's going on.
So Vanessa, I feel like you bring up a great point. And so as, you know, as a professional or as a parent, if I were to take a child to a professional that I felt weren't able to meet their cultural needs, what are the words? What do we do? How do we help guide our children to the right places? And how do we identify and tell somebody, you've not helped this, you've not helped this child? How do we do that?
I think it's the same as when you know, whether it be your dentist, your gynecologist, you have that discussion. You know, like I feel like, you know, there's, for some reason it made, like Beth said, you know, the first one may not always be a match for whatever reason, right? But to be able to articulate that, and I always tell my kids, if you don't like me, maybe I talk too fast, you wanted a guy and I'm a girl, or whatever the case may be. If you don't feel comfortable to say it to me, text it to me, because kids sometimes like to text rather than talk. text me, email me, or you can tell your parent or someone you trust to tell me that you do not want me as your therapist, but let me help you find someone else. So that is on us as the professionals to, one, make that disclaimer to say, hey, you may not like or feel comfortable with me, but let me help you find someone who you do feel comfortable with.
You brought up a great point, cultural linguistic competence training. Are there places that offer that?
So in the IDS field, so the Office Developmental Programs, we partner with, I think it was Morgan State University. There were trainings done on cultural linguistic competence, particularly because a lot of our individuals that we serve, while they do have an ID diagnosis, they also have a mental health diagnosis. Oftentimes they are African Americans who are in team meetings, if you will, with professionals who are with people that don't look like them, right? Trying to tell them about what's safe, what environment is safe, what environment is not. And the biggest problem is, as professionals, sometimes we put our own concerns of what we deem as unsafe in the space of a person that feels comfortable in that environment. And so we hinder their success and their growth when we do that. And so that training really helps break down some of the isms, right, within your own self when you're sitting at a table and you're thinking, okay, what are our similarities? Nothing. Or what do we have in common? Okay, at 25, I was drinking, right? I might have went into a neighborhood that my parents didn't think was safe, but I was safe, right? And nothing happened to me. I wasn't locked up or I didn't get beat up. So refuting some of those negatives. And those trainings could be really helpful for professionals of any ethnicity or background.
Can I add something real quick?
Yes, please.
So, and I hope I don't, I'm just going to say it. I think oftentimes it's really interesting when you put things side by side, because I would argue that to have a trauma-informed mindset or a trauma-informed approach is really the opposite of most current pedagogy, right? Because with the trauma-informed approach, it's really about time. It's about establishing the relationship. But when you look at a lot of the pedagogy, whether it's social work, whether it's whether it's doctors, like everything is supposed to fit in a very neat box, right? So sometimes, I like the beginning of Antoine Fisher, right? When Denzel Washington was like, you know what, these sessions don't start until you talk. I need you to feel comfortable with me. And I think oftentimes what happens, we just don't take time because it takes relationships. I'm pretty sure nobody on this call had a best friend overnight. Best friends take time. And then it's that whole notion of like, you know what? You do look like me and may have similar experiences. But the other thing is that you might not look like me, but I think you value me. I feel that I can be heard in this space. So, and I think oftentimes when people are hurting, all they're really looking for is validation. They just want to know that what they're feeling is valid.
Thank you. So if we move on to, I want to make sure that we get to hear from each panelist as we move into the section for next steps. And there's a lot. And I encourage you don't have to choose one of the things. I'm going to start with the question of, we all support some type of change. What supports do you need from the community and individuals that you work with to make an improved and healthy environment? Or what steps need to be taken, or how do we come together to make that happen? So kind of, we all want to see change. And so what are the things that need to happen? Beth, I'll start with you.
Well, I think what Vanessa said really struck a chord with me. I think we need more people in the helping profession and more opportunities for people who look like the clients and who have experience that they can explain and work with a client who feels comfortable with them. I think we need to create more opportunities, higher ed opportunities. I think we need to also, it's hard with funding, but create and have more agencies to go forward with, like, instead of, I see in court a referral to BHS for an evaluation, and this child just gets whatever therapist is available, or a parent gets whatever therapist is available. and that it looks bad to the court if they're therapy shopping because they're not completing their assignment. You know, they're not completing what the court wants them to do. And I think more education for, as Vanessa said, for the people involved in the system, for judges to understand, listen, one therapy appointment is not going to make a difference if it's not someone that this person feels comfortable talking to. You know, as Brandon said, it doesn't start until that person starts talking. They can go and sit and go to therapy and check off that box, but it's not going to make a difference if they're not getting anything out of it. So I think creating those opportunities and kind of having a more diversified helping profession, I think would make a world of difference for the populations we serve, and, you know, having people benefiting from those opportunities. So I don't know how we go about doing that, but I think in general, we need to create those opportunities.
Thank you. I'm going to go to Ty next, if that's okay.
Sure. So I'll add from a systemic perspective. As I stated earlier, I worked for the Department of Behavioral Health and Intellectual Disability Services, and oftentimes we work with the mental health court, right, or the police department, and there are these trainings like the CIT, the crisis intervention training, but to Beth's point, there are no real cross-system training. So you are in a mental health court, but they have no real understanding of the mental health services that you're receiving. And so oftentimes people are being placed in jail for things that the judge or the probation officer already knew they weren't responsible for in the first place, right? Just because the system said this person did not show up for this court hearing, they must be locked up. But you already told them they have 24-hour supervision and no one reported them as missing, right? So those kind of things. There's no real policies or checks and balances in that place. And just also, there's a lot of DEI trainings, diversity, equity, and inclusion trainings, but oftentimes there are only Black people that attend the trainings, right? There are no Caucasians or any other ethnicities in the trainings to have real conversation in the first place. And so oftentimes we're just talking to each other, and you don't really impact change in that way because the people we need to have the conversation with are not in the room. So that's part of the response.
Thank you. Karen Mcdougal.
Well, it's funny because this is not a new concept, and I have to digress a little bit. I grew up in West Philadelphia. I love West Philadelphia, but I grew up in the 70s, and I was the youngest of 3 children, especially at a time where there was a lot of racial tension under the Rizzo administration, with him serving both as the police commissioner and then the mayor. And I can specifically recall situations where the police would harass my brother and my cousins and his friends for no reason at all. They'd just be at the schoolyard playing basketball. And my mother, I recall what we're doing now, because I have 2 sons, and my husband had to have many, many conversations about my sons whenever they left the neighborhood or when they started driving. And I recall my mother having those conversations with me now. Mind you, this is 40 years ago. Okay, you're gonna play on the swing, your brother will be on the basketball court, and if the police arrive, you and your sister are to run home immediately to get me. And it's striking to me. It's so painful that this trauma, as Brandon has said, and all of you have talked about, was ingrained in me, and I didn't even realize the impact it had on me until I started reliving it with my children. And, you know, we claim we've come so far, and I have conversations with so many of my white neighbors and my white coworkers that say, oh, we don't have racism in this country. And I say, you have to walk in my shoes. Now, my brother, after being harassed and being taken into custody, never ever being arrested, my mother packing us into our station wagon and racing up to 54th and Pine Street to get him out because he looked suspicious or resembled someone who was described at the scene of a crime. My brother decided to counterbalance that by becoming a police officer in the city of Philadelphia. And when he told my parents, they were just shocked. They said, there's no way we will allow you to join that, how would we describe it? That institution that doesn't operate in a fair way. But his idea was, I will get involved. And that is the sentiment that we have to, I think, express to the young people today. And I remember President Obama, as he left office, he said, we need you young people to get involved in all areas. Law, if you see something that is not to your liking or that's not fair, put yourself in the position, gain the education, the experience, so that you can then affect change. We have to essentially encourage the young people and continue to encourage them to earn and then take a seat at the table. We have got to get involved. We have to affect change ourselves in all areas. And now I'm dealing with my son, who is finishing his last year at Penn State, and now he's decided to become a police officer. And my son has not had any run-ins. I live in this tiny little town of North Coventry with a population of 7,000. Everybody knows everybody. And I cannot say that he has suffered any psychological trauma, but I'm sure he has had his fair share of situations being a minority in an area where that is predominantly white, and going through the school system and working and just having friends. But he has decided that he wants to play a significant role in affecting change in policing in America. And he has carefully chosen his classes to study juveniles in the criminal justice system and women in the criminal justice system. And I am amazed at how excited he is to pursue this career. And I wasn't happy about it at all. I said, let that be someone else's child. I didn't want my child doing this. But we really have to impress upon the young people. And that's the reason why I'm on the board of the YW, because we cannot just live our lives. Everybody needs to play a role. We all have to do our part. And I think that's one thing that will help us in this journey.
Thank you so much, Karen. I'm going to repeat the question, and Ohiniwa, I'm coming to you next. We all support some type of change. What supports do you need from the community and individuals that you work with to make an improved and healthy environment, or what steps need to be taken, and how do we come together to make that happen?
So from a higher education perspective, I think I'll speak, and kind of that system of how we educate others to go out and do the work. I think a couple of things that we need to see more Black and brown people in faculty positions and in deanships or other leadership policy-making positions at the institution. I think that the only way that we're going to change the paradigm of how people know what they know or learn what they know is by changing who presents that information. Because as long as history is taught the way it's taught, and that's across the board, even as a professional social worker, I challenge the colonization of social work and how we need to start to think differently about social work. And so a part of it is the only way we're going to change and present more truth is to have more truth tellers in those spaces. And so that's going to look like, I work at an institution and I'm one of 2 Black faculty members out of a whole full-time faculty. And I was the only Black faculty member for 5 years. And then somebody else came on. But what happens, that composition looks like we have a diverse faculty, but diversity looks like gender or ethnicity. It doesn't look like Black and brown faculty who are teaching to a majority of Black and brown students. And I'm okay with that diversity, but I think that there needs to be an accountability when we're thinking about what we're teaching and how we're empowering people to move out. So that if I'm teaching a colonized version of social work to potential social workers, and then they go out and they're doing social work, they're going to state sanction the same stuff that's going on in society against Black and Brown, deputizing people. And so I think it needs to change in terms of who's at the table and presenting information. One of the things that I'm doing that's important for this year is I'm trying to revise our syllabi and our textbooks to be more reflective of what social justice work looks like if we're saying our mission is social justice. And that's a challenge because people want to teach how they teach. And they don't want to be challenged to always teach truth based on truth. So that looks like changing syllabi, changing textbooks, having more culturally relevant education, and then having people to show up in those spaces to be able to prepare culturally relevant practitioners.
Thank you. I love everything that you said. I'm running a nonprofit. The mission piece is so critical to me. I think it is the guide star for the YW. I run anything that we do through our mission. If it is in conflict with any part of eliminating racism, empowering women, or having dignity for all people, right? Like, we just can't do it. And I think that is a foundation for all good things when you have a mission that does that. I'm gonna move to Vanessa. If you need me to repeat the question, let me know.
Can you repeat it again, please? Thank you so much.
So we all support some change. What supports do we need from the community and individuals that you work with to make an improved and healthy environment? What steps need to be taken? How do we come together to make it happen? What can we do to help you help us? Okay.
I think I'll piggyback on what Oheniwa, I hope I'm saying it right, had said. I too, I work in a school district. I want to say 50% of our kids are of color, Black or Brown, African American or Latino. And we have like 150 teachers and only 3 of us are of color. So that means either biracial, Latino, or Black. And that is kindergarten through 12th grade. So again, children can't be what they can't see. So as Bev said, creating more opportunities for Black and Brown professionals. We do have Black teachers, they're somewhere, but they're not in our district. We do have Black psychologists, social workers, counselors, but they're not there. So constantly, having to combat implicit bias, because, again, if you don't think about it as a white male, as who's a superintendent or the director of people services, a special ed, there are certain things you don't consider. Right. And, across not just our district, but majority of our kids who are in special ed is overrepresented with Black and Brown children, especially in emotional support. Why? Because going back to what Ohaniwa said, the way we evaluate children. So again, the tools that we are using, who made them, for what behaviors constitute as emotional disturbance, was not by Black and Brown people, 9 times out of 10. So what we need is, again, that opportunity, as Beth said, to hire more people of color, that they can be a part of the decision-making process, is what we really need from, as a professional working in a public school system. Is that, I think, is so important and will help improve generations to come, because we are teaching them, as she said, people want to teach, they want to teach. We're teaching them. And we're teaching them from a European paradigm that they can never fit into.
Thank you. Latonya White.
Sorry, I was having some technical difficulties. I think that we struggle in Pottstown School District so much with this. I think that we have a lot of Black and Brown students, very limited Black and Brown staff members that are in a teaching role or professional role. And actually it is not to not having the efforts there. Legally, you can't just be like, are you Black? Okay, you got the job. It always has to be qualifications first, and really looking at that. I am happy to say we at least have 2 Black administrators. So yay that. And our superintendent is brown. So we do have some level of diversity, but when we're looking at our teaching staff, it's very few and far in between that you're seeing them. There might be some buildings that have maybe 1 or 2 period in the entire building. I think that what we find is that we also like homegrown. So we know our students, and if they're coming through and they need a way in, we get them in. Most of the issue is we're getting them in at these lower levels in hopes that they continue to grow, and us really trying to instill in that. But I do think that on the low, and this is my personal opinion, that we really do try to seek out, like, and it's sad to say, maybe based on your name or some things that you're saying in your resume, that you could have some ethnic background that allows us to say, all right, well, let's get you in for the interview. Let us get your foot in the door, and then hopefully you'll be able to get that job. But the issue is we don't have many people applying. We are running into that, and especially in the world of education, if educators on here would know that the number of students going into school for education has decreased rapidly, and what we're not finding are quality staff members that we can put in, whether they're ethnic or not, into the school systems nowadays. So it's even harder to be even more specific in getting that. But what do we do? What do? I go every year to all the buildings, and I'm really, especially at the beginning when I'm speaking to my administrators, and really going over that cultural linguistic information. Like, this is the difference between me getting someone's name spelled or saying someone's name incorrectly because we may have some unique names, and wondering why a kid is snapping versus anything else. Like, you got to understand the audience that you're teaching, whether you're sitting in front of whatever. And I think that is what we're going to need to do. If we're not being able to get those Black and brown staff in front of us, then educating those that we are getting is going to be our best tool.
And then Brandon, you said you wanted to be last. Here you go.
Thank you. So I'm going to try to come at this a couple ways, and I'm going to try to be extremely brief. I think one of the ways that you get change is that somehow you have to be the embodiment of the change that you wish others to seek. I think it's hard to ask people to change, but you're not necessarily giving them any indication with regard to what they are changing to. So, for example, I've been doing a mentoring program here in West Philadelphia, and I hope that the young men see in me that here is an individual who believes in family, believes in education, has not got caught up in the streets. But I'm very comfortable in West Philly. I don't walk around the streets with my head over my shoulder. So I think that's one thing. I think the other thing is just having things like this, where you're really having these courageous conversations, right? And there's another part to this courageous conversation. Sometimes courageous conversations become very, very cathartic. Sometimes people just need to express. And I always say that when someone that is hurting is yelling at you, they're giving you gold. But oftentimes we get caught up in how we're spoken to, but we don't understand that this person feels that they're coming from a history of not feeling valued, or they're coming from a history of just poor relationships, bad relationships. And at some point in time, they feel like that the only agency that they have is to be angry. But I try to tell people that are in the field, if you're dealing with an angry person, don't take it personal. Like, just understand that that is the language that they've adopted to communicate, right? So when we're talking about change, I mean, you know, it's a beautiful topic, but it's a slow topic, you know, because for me, it's all into change to what? And more importantly, why do I have to change? Because if I think that I'm okay, why are you telling me that I have to change? Or why are you suggesting to me that I need change? So, you know, I love working with the community, because the community looks at me like I'm crazy sometimes, because before we get to the work, I'm like, hey, just tell me how you feel. Let's just talk about your opinions on this situation before we can move forward. Because I'm recognizing that if I'm trying to have a conversation with someone and they have some hidden things with them, it's going to be very hard. So in my space, I just try to figure out what are the best ways to create those fraternal bonds or sororal bonds, or just people bonds, so that people feel comfortable to talk. Because I feel that when you can talk, that's when change starts.
Thank you so much. I've been trying to scroll through if we have any participant questions. The first one that I came to, and any one of you, any panelists can answer, how do we get more Black and Brown in these professions that we've been talking about, teachers, counselors, psychologists?
I would say at the higher education, it really is about creating access. And so if we have folks that are in there need to create access for people who want to get in. And some of that starts through adjunct instructing. Just having inviting somebody to your course. Brandon, I'll be talking to you. Inviting people to your course to teach a course, to teach a section for you, exposing them, to the administration, and then trying to ensure that they can either create a space for themselves. Some of the things that we do is have people with expertise come in and do a special topic that turns into an elective for social work or another course. And that's the way to have people get access to that space, because it is a very closed space. And so it's about us creating access for each other. And that's really important to understand.
I think that in the legal field in particular, especially in child welfare, we have a lack of men of color who are attorneys for our children. And I think that's very difficult for a lot of our male clients to not see someone represented as an attorney for them. And so I think in terms of trying to build those opportunities, Brandon, you mentioned a mentoring program. So kind of getting involved with those law students right off the bat and kind of getting in there, creating internships or any type of programming where they can get involved and see that they're making a difference. I think getting in, law school kind of bogs you down. So any type of positive thing that they can feel like they're doing and having an impact may change their mind about what type of profession they want to do. So I think getting in there in those schools and getting, right on the forefront, they can be a mentor as a law student, as an undergrad student. And I think if they're starting to get into those fields, they may develop that interest and ultimately get into being an attorney for these populations.
Vanessa or Latanya, do either one of you who are working with younger population students want to answer this question?
If I can add to it, I'm looking at the other end, the hiring end. One, the recruiters who go out to the colleges to talk to the students, make sure they're culturally appropriate, if that makes sense. Ohaniwa said about access, right? The access needs to be broadened, and it needs to have cultural appropriation, if that makes sense. So when I was 21 and I got into the field of child welfare and I was considering getting locks in my hair, a lady said, do you understand the social implications of that may block you from certain jobs? That doesn't look professional. So when you have young people coming out of school who may have, short hair, locks, half shaved or whatever, what is professional? They don't make it past the first interview. They didn't come with a blazer. Dressed nice, but they didn't have a blazer on. So they don't take this job seriously. So as professionals who were at the hiring committee, we need to maybe broaden our idea of what is considered professional. So that is something that I personally come across. When you come into an interview, you may have a Black superintendent, but that's not who your director of HR is. So unless you know superintendent personally, that you can say, hey, I interview on Thursday, look out for my application, they have no idea. So we need to broaden the horizon of what we consider to be professionally appropriate, unless I had to learn how to hide who I was until I got the job. And young people, they don't want to do that. I want to be able to be authentic and be me and be hired for being me. And I think, at least for me in education, because I'm not an administrator, I'm a part of the staff. I feel like you can't do that to a point.
That's a great. Latanya, did you want to add?
I think that if I'm looking at it and shaping young minds to wanting to go into the field, I think we have to provide them with better experiences. Like, in all honesty, like, if we're not providing them with better experiences, why would they want to do that? You know what I'm saying? Like, it's funny because when like in my early years in education, I did a lot of alternative ed. And every now and again, I'll run into some students who are like, oh, I'm mentoring kids now. Oh, that I'm getting into this, because their experience was changed. They was in a regular school district. Things weren't working well. They went into a smaller environment, an alternative ed school, where people were really able to work with them and really start molding them. And then they were able to see, oh, now I see what you guys do. But I think that their experience with all these other variables within a school district sometimes blocks what they really need to see and what teachers really do, and the caring that they do have behind that. Now, those are on different ends. That could be a leadership issue, that could be a teaching issue. There's a couple different things. But to me, if I really want to start molding kids into going into this field, I would definitely work on providing them with meaningful experiences of what it is to be a teacher or an educator or a mentor. But I also would caution the different things that come down from government that doesn't support the teaching field. Like, people aren't just running out of the field for no reason. They know that money-wise, it may not be as fulfilling. They know that sometimes safety isn't the best thing. And when you're talking about public education, and if those are the experiences that they're having or hearing, why would they come into the field? So to me, it's really about knowing your kid, understanding what they like, and really honing whatever it is that they're trying to do, be it teacher or not, and really tap into that.
Thank you. Another question from our chat asks, how can I, as a single woman, with no children, support truth telling to our children? Somebody talked about truth telling to our children. Was it you, Ohiniwa?
It was. I think it starts with whatever is age appropriate, but just truth. So when you think about how would you talk to a 5-year-old about police brutality, it's not saying, it's just age appropriate. So what is age appropriate? And a part of that is following the lead of the child. The child is going to tell you how much they know, and then you continue at that level of what they know. I give a prime example outside of that, but when we talk about sex to children, sometimes as adults we go way overboard, and children may ask you, where do babies come from? And they just want a basic answer, and we go into a whole long from the whatever to whatever, and some of it is follow the lead of the child, age appropriate, and then make sure that you understand truth for yourself. That's probably the most important thing, because if you have a conflated idea of truth, then you're going to transfer that to your child. So understanding and working through that for yourself, and if you need to do study for yourself, and then once you can get a grasp of it, then what's age appropriate for that child. And then there are tools out there. Like, we don't have to always be the bearer of it. We may be able to access people who can provide us with that information. But a part of it is, what do you know for yourself? And then how are you going to provide it to your child or children that is age appropriate?
And if I may,
Please.
I think I just want to add one thing to what Ms. Ohiniwa said, and that is sometimes you have to get permission to tell the truth. So this is what I mean. I think oftentimes people come in with very good intentions to want to educate, but then my question becomes, is your education the opposite of what my family tradition, legacy, or values are? So you might have come with the noblest intentions to talk to me about police brutality, but if my family has taught me something else and you're teaching me something different, you quickly become an enemy of the family. So oftentimes when you're going to have these sensitive conversations, right? And for me, I kind of lump like religion, sex, believe it or not, conflict resolution, Like I call those all sort of like my hot topics. And when I'm about to have those conversations, I let people know what I'm going to talk about. I'm like, here are the resources. This is where I'm coming from. If you have any problems, let me know. If you want me to talk to you as a parent before I talk to your child, let me know. But I think oftentimes people that want to be truth sayers, they do it too soon, they do it too quick, and they didn't get permission.
And I think going off of that, just knowing your own limitations, knowing when you need to do more research and education, and saying to the child, you know what, I don't know the answer to this. Because you're not going to know the answer to everything. You're not going to be, as Brandon said, you're not going to be the expert on that certain thing and of their truth. So working with the family, but knowing when you need to say, you know, I don't know that answer, but I'll figure it out and we can figure it out together and find someone who does know that answer. So I think knowing your limitations is very important.
And if I can add another level of honesty, you know, sometimes people's truth is just their opinion.
We are coming to the end